Wonderful. Praise God. So thank you all so much again for being on this COVID-19 vaccination webinar. Greatly appreciate that. I want to introduce Sharika Jones. I'm so excited that she decided to be on this particular webinar. This really suits her a great deal. She has a lot of information I know to share with you, but some things that you need to know about her background for those of you that do not know. She's indeed a family nurse practitioner certified by the American Nursing Credentialing Center. Her academic background includes a degree of Bachelor of Arts in Political Science from VCU, absolutely, Associates of Nursing from J. Sarton Reynolds Community College, and a Master of Science in Nursing from the Simmons University in Boston, Massachusetts, where she graduated with honors as a member of Sigma Theta Tau International Honor Society of Nursing. She specializes, get this, she specializes in adult chronic health. And look, while I'm doing this introduction, my two boys are trying to get treats and stuff from me. So we're gonna get them in the process too. Want to say hi real quick, wave.
Hi, I'm Sharika.
Hi, there you can say good. Say do a great job.
Do a great job. Hi, it's Nikki.
All right. Okay. See y'all later.
Hi, that's right. Hi,
that's right. Bye-bye. All right. So she has a lot of things she brings to the table. I could share a whole lot more. One thing you definitely need to know that with her credentialing, she has the ability and the authority to prescribe medications for many common health conditions as a family medicine provider. You should know that she has over 10 years of a nursing experience, education, and practice, licenses granted by the great state of Virginia. I always like to say, this Black girl rock. There's no question about it. We use her all the time, always. It may be late at night, say, hey, what do we do? She is definitely knowledgeable. So I'm hoping and praying that all of you are able to glean a lot of information from her. Just a wonderful person to be around. So this is a treat. I see this as a treat for all of us on this webinar. So with that being said, I know I probably set the bar kind of high, but she's going to exceed that bar because I truly believe in her. So without further ado, I'll introduce to some of you and present to all of you none other than Sharika Jones, family nurse practitioner, great member of Abner Baptist Church. So I'm gonna stop talking. I'm gonna turn it over to her. So we're gonna, I guess, give her an opportunity to unmute so she can talk at this time. Go right ahead, Sister Jones.
I am unmuted. Well, good evening, and thank you, Pastor Hayes, my brother-in-law, for that wonderful introduction. I appreciate it. Thank you so much. And I'm happy to be here. This is quite an honor to spend this time with my church family and friends, whoever else may be on this call or webinar this evening. I appreciate you taking the time to spend with us as we dive into discussing coronavirus and the COVID-19 vaccine. I do want to preface this webinar and this presentation by saying that the information provided is going to be applicable to most everyone. If you have a family care provider, doctor, nurse practitioner, someone who manages your care on a regular basis, I do suggest that you follow up with your doctor to discuss any specific health issues that you may have. I will do my best to address any concerns or questions that you have this evening. And I do ask, with regards to questions, feel free to jot them down as you're listening to the presentation so that I may be able to address them towards the end of the presentation this evening. Okay, with that being said, I am ready to get started. So we will go on and move to slide 1. It looks like we have our title page up here. So again, we're just going to be talking about coronavirus and the COVID-19 vaccine, information that you have been met with quite frequently in the news and in the media. And so I am happy to discuss that with you this evening. Okay, next slide, please. Okay, so first, what I would like to do is discuss with you exactly what is coronavirus. And I know that you have seen a lot of it since last year, but you might be a little confused. Some of you may want to know specifically, well, what is it? So the main thing that we need to know about this virus is that coronavirus, of course, is a highly contagious virus with a medical name known as severe acute respiratory syndrome, coronavirus 2. Now, this coronavirus virus itself has caused something called coronavirus disease, better known as COVID-19. This was first detected in China, excuse me, back in 2019. And this virus soon made its way to the United States and around the world, creating the pandemic that we are faced with today. It has crippled the health of millions of people, resulting in over 1 million deaths worldwide. And the CDC has so far reported 27 million coronavirus cases and over 480,000 deaths just in the United States alone. So globally, the World Health Organization reports that there's been over 107 million confirmed cases of COVID, reported 2 million deaths that we are facing with. And this is still occurring. It's not over. So it's important to keep that in mind. Now, COVID-19 mainly spreads from person to person. We're aware of that. And we know that it occurs with transmission through close contact of other people within 6 feet and through respiratory droplet particles that are suspended in the air. These droplets can be inhaled, land in your mouth, your nose, and then you take that in and thus you are infected with the virus. So now we'll take a moment to go ahead and review the symptoms of COVID-19. Before we move on, actually, I want to say that there are variants that we are noticing of this virus, so different variations. And there are multiple variations that have been detected. These variations occur naturally. If we have the viruses circulating out in the community and we haven't controlled it quite yet, we're giving the virus an opportunity to sort of mutate and sort of develop a stronger method of evading our safe practices and our vaccines that we are trying to come up with. So it is so important to adhere to the precautions that are recommended by CDC for the current strains that we have at hand, which will help us have better protection against the multiple variations and new ones that are likely to come in the future. Okay, next slide, please. So let's take a look at the coronavirus symptoms. Many of you, I'm sure, are aware of some of the major ones, such as cough, sore throat, fatigue, fever, body aches, muscle aches, headache that can occur. You can also have runny nose. For some people, they liken the symptoms to flu or just having the common cold, but we know that this is far worse than flu and the common cold. These symptoms can be very mild and can last maybe for 1 to 2 weeks. But it's important to know that once you've come in contact with the virus, whether you know you've been in contact with it or not, there's this phase of time that can occur where you can develop symptoms. So anywhere from 2 to 14 days from when you've been in first contact with the virus before you start to notice symptoms. And again, these symptoms can range from being mild to severe, where you have, cough, sore throat as a mild symptom, and then severe respiratory, failure, or just land yourself in the hospital because you can't manage these symptoms. So that's very important to remember. In most cases, again, it's going to affect your patients or your population who are younger, maybe between 18 and 55 years of age, who have mild symptoms. But it's important to know that no matter what age you are, if you have underlying health conditions, such as being obese, some of us have a little fluff that we need to lose, but that obesity, believe it or not, does increase your risk for illnesses and health complications. So obesity, diabetes, hypertension or high blood pressure, having heart failure, heart disease, kidney disease, cancer, asthma, smoking are some of the underlying health conditions that you can have, which will set you up for difficulty fighting COVID-19 disease if you were to be infected. One of the things that I really want to reiterate is that many people have no symptoms at all. And I can't stress it enough, no symptoms whatsoever. And then, you may just decide you want to be tested for COVID because you have a curiosity. You just want to know, do I have the virus? Have I had the virus and now have antibodies and just didn't know it? So because you can have the COVID disease, COVID-19 disease, and not know that you have coronavirus symptoms, it's ever more important to keep your mask on when you're out in public, when you're around loved ones who you don't see on a regular basis, or if they're not in your bubble, because you can in fact transmit the virus without having symptoms to others who have a low immune system, fighting chronic health conditions, and unfortunately can catch the virus and develop COVID-19 disease and not be able to fight it. So that is something that I ask that you please keep that in mind. Okay, next slide. Okay, so let's talk about risk factors for COVID-19 disease and complications from COVID-19 disease. One of the main indicators is going to be increasing age. So we know, yes, anyone can acquire COVID-19. And as I mentioned, although adults of middle age are going to have mild symptoms, it's our older population who can develop severe disease. We are noticing that our elderly population greater than 65 years of age, unfortunately have an increased risk of death, complications from COVID-19 and death. So be mindful when you're around your elderly population, keeping your mask on, keeping your nose covered. The nose and the mouth is part of the respiratory tract. And so we want to prevent particles from coming out of our nose and out of our mouth and infecting those that are at great risk, such as the elderly. Again, the underlying health issues. So again, diabetes, high blood pressure, COPD, history of smoking or just smoking occasionally. Those things increase the demand on the body so that when you are met with illness, be it COVID-19 or really flu or any illness for that matter, it's going to create an extra demand on your body to try to fight that illness or that virus if you're not already in the best, tip-top shape that you can be in, which is a state where your body is, at its optimal health level. So if you have any chronic condition, I know a lot of people, especially in our circle, our African-American population, have high blood pressure. Well, that's fine. High blood pressure, monitor your high blood pressure, making sure that blood pressure is controlled, taking your medication, when we're supposed to take it, making sure that blood pressure is right where it's supposed to be. So that if in fact you do fall ill and you come in contact with the virus, you're not already outside of the normal window where we want that blood pressure to be. If you're already high and then you're infected with the virus or infected, with any other health condition that's going to raise the blood pressure, then that's going to be an extra demand on the body. So let this be an incentive, of course, to maintain your health, take your medication, control your diabetes, take that insulin if you're on it, just take it to maintain your health so that you can be set up for success to fight the virus if you were to come in contact with it. And again, being of minority race. So not just African Americans, but African Americans, Hispanics, Asians, but particularly for us, for African Americans, the literature does show that there is increased hospitalization for African Americans who are infected with COVID-19. And we are at increased risk for suffering adverse outcomes. And by adverse outcomes, I mean, respiratory failure, developing pneumonia, something called COVID pneumonia, having the risk of developing, strokes or even heart attacks in the hospital. I mean, there's a multitude of complications that can occur when you are infected with COVID-19. So let's be, mindful, keeping that at the forefront of our minds, knowing that we have our health conditions that we want to maintain and monitor to prevent illness, but also knowing that we, because of our race, we are at increased risk. So that's extra incentive to make sure that we are taking necessary precautions to prevent illness with COVID-19. Okay, and next slide. So how can we prevent infection? Well, many of us watch the news, we watch the health briefings, and we watch Dr. Fauci. We love Dr. Fauci, don't we? Telling us to wear our mask, to mask up. So it's understandable that many people out in the community are probably getting mask fatigue and say that it's difficult to breathe or you can't keep it on all the time. But I implore you to please keep it on. It is difficult sometimes, if you have to take a breather, to get a little bit of air in, then that's understandable. But keep the mask on, keep your nose and your mouth covered. Because we know that by wearing your mask, you're decreasing the chances of you expelling those particles out into the air and infecting someone else. And by wearing a double mask layer, which is now the recommendation, that is meant to help give you some protection against the variances of the virus that we're seeing now out in the community. So, unfortunately, I'll get to the vaccines in a little bit, but unfortunately, the vaccines that we have right now are not showing a lot of efficacy for the variations that are circulating. So I think Pfizer may have some, effectiveness, but because it's not a guarantee, the best thing we can do is keep the mask on and wear that extra layer of protection by double masking if you can to prevent transmission of the virus. Again, stay 6 feet apart from others. If you're in the grocery store, you're standing in line, and if there are, the little, stickers on the floor that tells you stand here, stay 6 feet apart, please, be sure to abide by that. That really is there for all of our protection to make sure that we are not too close for comfort and coming in contact with someone who could be positive, someone who's deciding to not wear a mask or wear it properly. Of course, washing our hands frequently and using hand sanitizers. And of course, I recommend if you're in the grocery store, clean the carts, clean your hands with sanitizer before and after. And I even make sure that I clean my hands again before I get in the car and touch the steering wheel, just to really make sure that you are observing good hygiene and hand cleanliness to prevent the spread of the virus as well. Here's a big one, stay home if we're sick. So, because we don't know if we have a cold, sinus infection, flu, or COVID-19, which is, a reality these days, let's just stay home, instead of just saying, well, I'll put my mask on and go out, you may, out of habit, say, I need to sneeze and pull your mask down and sneeze, So, it's so important to stay home, not just for your protection, but for the protection of others who may have to go out, who have a doctor's appointment or weekly visits to their healthcare provider that they can't miss. So let's decrease the chance of them bumping into any of us who may be sick while we're out and we pass the virus to them. And so what else can we do? The big one, get your COVID-19 vaccine. Yay, that's the main thing that we are all interested in. And I know I am so happy that we have it out on the market now so that we can get this vaccine to help prevent disease from coronavirus, COVID-19 disease and complications. So that is such a blessing that we're able to add this to this slide this evening to even have it as suggested as one of the preventative mechanisms for COVID-19. So on that note, let's go ahead and talk a little bit about the vaccine. Next slide, please. All right, I am aware that a few of you have already received your COVID-19 vaccine. So big round of applause for you all that have received it. I think it's so wonderful. And I know a few of our elderly members and friends have received it. So that just warms my heart and just gives me such joy to know that you've taken the vaccine. So I am going to cover the types of the vaccines here. For those of you who've already received it, you may know this information, but it doesn't hurt to review it again. So I will say there are a few vaccines out there, but there's only 2 right now that has received emergency authorization, and that is the Moderna and Pfizer vaccines. So they've received emergency use authorization here in the United States. In case you're wondering, well, what does that exactly mean? What is emergency use authorization? Did they just, rush this through? I don't know anything about this vaccine. What does that mean for me? So I will say that emergency use authorization simply means that the FDA, the Food and Drug Administration, has received enough data from the clinical trials that were done for these vaccines to say, okay, the benefits of this vaccine that you've shown me in the clinical trials have outweighed any of the risks or any of the small concerns that may have been apparent with these vaccines, so that we can go ahead and get it out to the general public. Because the benefits outweigh the risk of not using the vaccine at all, emergency use authorization is given so that we can go ahead and implement it and not wait for a longer period of time, which some cases for clinical trials can take years to get that final approval. So enough data was received during the clinical trials to say, okay, this is considered safe enough to go ahead and start implementing now. So it's so important that we have that understanding. I know in the beginning when there was, earlier last year when there was talk about the vaccine, I think the consensus in the general public may have been, well, whatever vaccine they come out with, it's too soon. I don't want it. There's no way you can come up with a vaccine, this soon and have it be safe. Well, there is. And that's why we have something called emergency use authorizations, because this is an emergency. We're in a global pandemic, so we don't want to wait years for approval. We want to have enough data, come to light to suggest its effectiveness and safety so that we can go ahead and get it out to the public to start mitigation of risk, to decrease the risk of death and complications. So that's where that emergency use authorization comes from. And, it's so important that we have that. The next thing I want to address about the vaccines is that they are not a live vaccine. What do I mean by that? It's not a live virus that you are getting injected into your body to fight the virus. So it's not live. This is something called an mRNA vaccine. And without getting too technical about it, I will tell you that it's just simply a vaccine that is packaged and introduced into your body, your cells, your immune system will take a look at it and say, oh, okay, this is an invader. This is an antigen that I need to fight. And it will remember what was injected by just, encoding it into the cells and remember it so that when you come in contact with the virus, if you come in contact with the virus, you will have antibodies to fight it. That is the goal of the the vaccine, to fight the virus, not to infect you with it. So that's just something to make sure that we remember. I want to make sure that we're clear about that, that you are not going to be infected with coronavirus at all or develop COVID-19 disease from getting the vaccine, excuse me. So the biggest takeaway from the vaccine that we want to happen is the development of antibodies. So antibodies, again, is going to be those think of it as part of it being your white blood cell system, your immune system, developing to fight the virus if you were to come in contact with it. But it's important to know that it does take 1 to 3 weeks for antibodies to develop. You don't develop them all at once, immediately take the vaccine and you're done. You may develop some, within a few hours, 24 to 48 hours, but not nearly enough to say that you are immune to the virus. It does take time, particularly, 1 to 3 weeks between each vaccine to develop these antibodies, and it does take time. So it's important to make sure you're cautious still after you get that first dose, that you remember you don't have full antibody effectiveness quite yet. So keep wearing your mask, of course. As far as effectiveness, so we have the 2 vaccines, Moderna and Pfizer. Both vaccines are over 90% effective. Pfizer vaccine is known to be 95% effective after both doses, after you've received both doses. It's only 52% effective after 1 dose. So it's important to make sure you get the second dose, because if you look at the 1 dose, 52% effective isn't much. It's some protection, but not enough. Moderna vaccine is 94.1% effective after 2 doses. The good news with Moderna, though, after dose 1, there has been a reported 80% effectiveness delivered after 1 dose. And that is promising, that's wonderful, but the concern is we don't know how long the immunity lasts. We don't know how long that antibody production after the first vaccine lasts. So with both, we still recommend getting both doses because you want to build up enough antibodies, enough protection for the long haul to fight COVID if you were to come in contact with it. How they're administered is that they are given intramuscularly. So it is an IM, an intramuscular injection into the upper arm, so right into the deltoid muscle of your arm. Either arm is fine, it doesn't matter which one. You want to make sure that you adhere to the recommended time frame, though, when you get the vaccine. So with Moderna, it is a 28-day time span. So from dose 1, after you receive the first injection, you want to get the next dose as close to the 28-day mark as possible. Same with Pfizer. After dose 1, you want to make sure you try to get it as close to the 21-day mark as possible. And I say as possible because we know life happens. We know that you may forget. You might have an appointment. You might not be feeling well and can go and get that second dose on the day that's recommended. If you can't, that is okay. It does not mean that you have to start the vaccine all over. It does not mean that you have to take it and then go back and get another one. Right now, the recommendation just simply says, if you miss your time frame to get your vaccine on the second follow-up date, just get it as soon as you're able to get in for that next appointment or as soon as you remember. It's better just to go ahead and get that second vaccine, then that second injection for the vaccine, than putting it off or waiting or not getting it at all. Next slide, please. I do want to make sure that I address the main concern here with the mRNA vaccine. There's just some myths and some concerns out there, at least that I've come across, that I want to address. And that being that the mRNA vaccine, which is, again, just the type of vaccine that this is, it's just how it works in the immune system of your body. mRNA is part of DNA, yes, but once you get the vaccine, it will not alter your DNA. You will not grow a third leg. You will not glow green at night. You will not change. You will be you. Some of you may wish that a loved one changes into something else afterwards. No, you're not. This vaccine does not alter your DNA. So I just want to make sure that is clear. No, so it won't change your DNA. And, we chuckle about it, but I know that that concern is real for some people. Not all of us are biology majors and, spend a lot of time studying, this information. So it's so important to understand that no, it will not alter your DNA. I've had my vaccine. Many of you out there have had yours as well. And we're still the same person. My DNA hasn't changed. My skin color, my eye color, nothing's changed. So just want to make sure that I address that. Also, it is not possible to get COVID-19 disease from your COVID vaccine. COVID-19 disease is the state being, actually infected with the virus, being ill, developing complications, landing yourself in the hospital, etc. While that may happen, if you were to become, infected with coronavirus, it's impossible to get that disease, become infected from the vaccine that's not a live virus. Your body simply recognizes the injection as being a foreign invader. Let's build antibodies to try to attack it so we'll remember what to do if you were to come in contact with the vaccine. One of the main things about the vaccine, definitely, that I want to address is a misconception, I think, among many, that the vaccine will prevent you from ever getting COVID or coronavirus or COVID-19 disease. It would be wonderful if this vaccine was guaranteed 100%, guarantee approval. You will never get COVID-19, but that's just not the case. And that's not the case with many vaccines. The vaccines such as your flu vaccine, shingles or Shingrix vaccine, vaccines are meant to give you a layer of protection, meant to boost your immunity so that if you were to come in contact, with any virus, it will decrease the complications that you may experience or decrease the symptoms that you may experience from the virus if you were to come in contact with it, because you've already built up your antibodies. Think of your antibodies as an army that's ready to fight for you if you were to be infected. It is very much still possible, yes. I know it's not the best news, but yes, it is possible to still become infected with coronavirus. But the hope is that if you were to become infected with coronavirus after you've received your vaccine, you may not have any symptoms at all. You may not know that you've even, been infected with it unless you've gone to take the test or you just happen to have a test done and it shows that you're COVID positive. Well, then the vaccine, believe it or not, did its job. You didn't land yourself in the hospital with severe complications. You didn't develop respiratory failure. You didn't develop, debilitating symptoms where had you not had the vaccine, the chances are you very well would have. So that vaccine is meant to give you some protection from complications and development of COVID-19 disease. But again, it is not a guarantee that you won't ever come in contact with coronavirus. So that's just important to stress. I also want to mention that there is also the idea that, well, if I've had coronavirus before, and since I've had coronavirus, my body has created antibodies, well, then why do I need the vaccine? Do I really need the vaccine? And we can go to next slide, Nikki. I think I may have that on the next slide. Actually, I don't. I'm sorry. Okay, go back, please. Thank you. I'm going to address that statement. If you had coronavirus, yes, your body has mounted some antibodies. Yes, you have maybe some protection from developing it again. But the problem with that statement is we just don't know how long. We don't know how long your antibodies, how long that sort of protection will last. So for that reason, it is so important that you get the COVID-19 vaccine. We just don't know how long the protection that you have from having COVID will last. Again, it's a new virus. We don't know too much about it. We're learning. We're going to have a lot of studies and look back at, retrospectively looking back at studies to see what we can learn from it. And then perhaps in the future, we'll have some suggestions. But right now, the recommendation is don't rely on being infected with COVID to say, now I've created antibodies. Just like chicken pox when I was a child, your mom wanted you to get it, all the kids to get it so that you can say you're done with it and now you're good. That's not the case with COVID. We don't want to play that game with COVID because it's a risky game. You can get infected with coronavirus, develop COVID-19 disease, and unfortunately, not live to make it to look forward to having antibody protection. So that's one of the main things that I want to mention about that. All right, now we can go to the next slide. Thank you. Okay, so what to expect when you get your COVID-19 vaccine? The COVID-19 vaccine, very simple, just like you get your flu shots, going to be injected right into that deltoid muscle in your arm, left or right, doesn't matter. It is important to know that it is going to create some soreness right at the injection site. For most people, you do have a sore arm. Generally, it goes away in about a day or two. It doesn't last too long. You may have headache, fatigue, feel really tired, and just feel like you just lost some energy for a little bit. You might notice that you have some chills, maybe a low-grade fever. And by low-grade fever, I mean 99.9, maybe 100. In some cases, 100.1, 100.2. If that happens, it's okay to take a little Tylenol or ibuprofen for your symptoms. That's completely fine to do. The systemic symptoms, such as body aches, chills, nausea, vomiting, lymph node swelling, which does happen. Actually, for me, when I had the vaccine, I did have some lymph node swelling. Those things can happen because, again, it is almost mimicking the COVID virus, almost as if your body is fighting the virus, coronavirus. So you're going to have some reaction that's expected, and that's actually a good thing. That is the positive side to this. We want you to have some reaction because it means that the vaccine is working. Your body is recognizing this to be something it needs to fight, and you're developing antibodies. When you develop those antibodies, you're going to feel it, you're going to notice it. But generally, those symptoms will go away in a few days. If the symptoms last longer, than 3-4 days, if you notice that you have a fever that you just can't keep down, you have swelling in your lymph nodes that won't go away after about 7 days or so, then talk to your doctor. Maybe set up a virtual visit, or if they're accepting patients where you can go in, mention it to your doctor. Most of the time, they'll just watch you because, again, this is expected. But if it's worsening, you have worsening symptoms, make sure that you just reach out to your doctor just to get a second set of eyes to look over you. Now, talk with your doctor about getting the COVID-19 vaccine. If you have a history of allergic reactions to vaccines in the past, not medications, not dogs, not pet dander, not cats, not flowers in the garden, but vaccines. And the reason why that's important is because there's a particular ingredient in the COVID-19 vaccine that can cause an allergic reaction, particularly something called anaphylaxis, where the throat closes, difficulty breathing. And you want to make sure that you don't have that type of allergy. If you've had vaccines before in the past and you've tolerated them well, then there's every indication to suggest that you'll tolerate COVID-19 vaccine well also. If you have a compromised immune system, so if you have recently gotten over cancer, or if you are currently fighting cancer, if you are taking medications that lower the immune system, medications for chronic health conditions like chronic arthritis, rheumatoid arthritis or systemic autoimmune conditions. You want to chat with your doctor, make sure that your immune system is strong enough, your white blood cell count isn't too low, where you won't be able to mount that antibody, that immune protection, immune response that you need to fight the vaccine or to fight the virus, Also, if you have a blood disorder, so if you have a clotting disorder, if you're on blood thinners, such as Coumadin, we still use Coumadin or warfarin, or have a clotting history, doesn't mean you can't get the vaccine. Just check with your doctor. Just make sure that you are okay to tolerate. Your blood level isn't too thin, where if you get the vaccine, you'll continue to bleed. So again, if you're on Coumadin, you're taking medication that lowers your threshold for bleeding, make sure that you are stable enough to receive it. If you've had COVID-19, as I mentioned, yes, you can still get the vaccine. The recommendation, though, is that you wait at least 90 days. And why is that? We want to wait 90 days because once you've been infected with the virus, your body has already tried to fight it. You've built up an immune response. You have antibodies circulating in your system. So we want you to be fully recovered over the infection and sort of back to your baseline when you go to get the vaccine so that the vaccine can work for you. But you can still get it even if you've been infected. Do not take Tylenol, ibuprofen, Benadryl, anything over the counter before you go to get your vaccine in an attempt to decrease the side effects. And the thought behind that is that it will decrease your immune response. So while you might not have any pain in your arm or you might not get the headache, you might not mount the immune response that we're looking for. So we just don't want to interfere with that. It's okay to take it when you get home. If you have a headache, sore arm, go ahead and take it, but just don't take it, immediately before going to get the COVID-19 vaccine. Okay, next slide. Okay, so with this presentation, you probably can guess that my recommendation, yes, is to go ahead and get your COVID-19 vaccine. But for those of you that may be wondering if I do recommend it, yes, I definitely recommend it. Please get your COVID-19 vaccine. If you look at this picture over here to the right, it's a patient being wheeled in, fighting COVID-19. It is so important that you prevent yourself from landing in the hospital with COVID-19 disease and complications and risk of death. So please get your COVID-19 vaccine. Right now, this is the only, tool that we have in our toolbox to really say, this is what we can do to prevent the complications, to prevent landing yourself in the hospital, on oxygen, trying to breathe, fighting with the ventilator, to get over this virus. So besides masking up, washing your hands, staying 6 feet apart, I'm happy now to say that we have something that we can say has been working to prevent complications from coronavirus, to prevent, symptoms from coronavirus. So please get the vaccine when you are able. I recommend it. Most all of us fall in the category where we can go ahead and get it. It's only, a few patients who might not be able to get it right now. Those who have COVID-19, those who have too weak of an immune system, or those who have an allergy to the vaccine itself. Otherwise, we all should be, signing up ready to get the vaccine. For those of you that may be pregnant or trying to become pregnant, discuss with your doctor, your OBGYN, your situation specifically as to whether or not you should get the vaccine. Most clinical trials do not include pregnant women, and that is for their protection and the protection of the unborn baby. These trials for COVID-19 vaccine, I think they are going to look into incorporating some pregnant women to see how it affects women who have either become pregnant after getting the vaccine or who are currently pregnant. Right now, there's no recommendation to not get it, especially if you work in healthcare, if you're a teacher, you work in the community, go ahead and get it. But just, speak with your doctor just to make sure that there's nothing particular to your health situation that would preclude you. Medications that treat COVID-19. I know there's been talk in the media about remdesivir, steroids, convalescent plasma. Those are all very real medications, yes, that are used to treat COVID-19, but those are used in an inpatient setting. It's used to treat our sick patients who we're trying to save. We're trying to prevent them from dying. My husband comes home, many of you know he works in an ICU setting. He comes home quite a bit, speaking of patients that they did everything for in ICU, throwing all sorts of medications at them. You think they're making a turn for the better, and they just don't make it. So, please, I know in the media, we hear about these medications. I just don't want that to be a thought in the back of our minds that, well, if I get it, there are these medications that can help me. That's not a guarantee. And in most cases, they don't work. And so again, the biggest takeaway is to get your vaccine to prevent complications and ending up in the hospital. Okay, next slide, please. All right, here's the big kicker here. How do I get my vaccine? Boy, and if I had a guaranteed way to tell you to get it, I'd be $1 million richer, I'm sure, but I won't be. I will tell you that today, though, the state of Virginia launched a new website called Vaccinate Virginia, where you can log on, register, pre-register to get your vaccine. Now, the good news is if you did sign up through the Virginia Health Department website, your name is supposed to carry right on over to this new platform where you're already in line waiting to get the vaccine. And you'll be contacted by a representative who will schedule your appointment, and then you'll go and get the vaccine. What's supposed to happen is that retail pharmacies, other areas that is set up to administer the vaccine, they're working in conjunction with the state, with Virginia Health Department as well, so that they can be the arms to give the vaccine from patients on this list. But we know things have not been going as planned, unfortunately, regarding the COVID vaccine rollout. And so my hope is that with this new website that's set up, again, vaccinate.virginia.gov, you'll be able to get through, put your information in, register yourself, register a loved one, so that you can be in line to get your vaccine. The good thing with this website is that once you sign up, you are given a confirmation code immediately to let you know that you've been successful in registering, and you will be contacted. And hopefully you all are signing up, and you'll be contacted soon to get your vaccine. Okay, next slide, please. It's like we're doing good on time here. Before I continue, I just want to let you know that I did get these questions that came through that were submitted to the Abner Baptist website, for me to address. I'm happy to address these questions. If there are any additional questions that you may have, please feel free to put them in the chat box, write them down, and I'll be happy to address them. If I'm able to see my chat box, let's see. Okay, I am going to start with these questions here on the screen. All right, so the first one is, can I still get the COVID-19 vaccine if I use a Cpap machine for sleep apnea? Great question. Yes, you can. In short, you most certainly can still get your COVID-19 vaccine. Sleep apnea is not a virus or anything that will interfere with a COVID-19 vaccine. So, we certainly want you to maintain your airway as you're sleeping at night. So please continue to use your Cpap. Don't stop use of the Cpap before you get your vaccine, because the two do not interact, and you're definitely able to still get your COVID-19 vaccine. I will mention that if you have COPD, severe asthma, or any respiratory issue, please be sure to discuss it with your doctor. Most of the time before you get your vaccine, there's a little checklist that you have to complete where they're going to ask you about your health history. If you do have severe asthma, get claustrophobic, difficulty breathing, you want to mention that on your sheet. Okay, the next one, is there a link between COVID-19 vaccine and Bell's palsy? Great question. Bell's palsy, for those of you who may not know what that is, Bell's palsy is a temporary, it's a temporary condition where you have paralysis of the face. It can occur on either left or right side of the face. Generally, it occurs from a viral infection from, if you've come in contact with the virus years ago and you may not have ever gotten rid of it fully. The nerve, facial nerve, can sort of become inflamed and induce a paralysis on side of the face. So there has been some talk in the media about people who've received the COVID-19 vaccine. A few days later, they had Bell's palsy or they had paralysis of their face. It's important to know that yes, it can happen, but it's very rare. In the literature, in one of the studies that I read, most of the patients who developed Bell's palsy, some of them had previous injections of Botox or fillers in their face, and so that set them up for increased risk for development of Bell's palsy. Others that happen generally around, I want to say day 3 or 39 after the vaccine, but then went away in a matter of days. And those patients would recurrently get flares or episode of Bell's palsy throughout the year. So if you have had a recent Bell's palsy flare, or if you're currently exhibiting Bell's palsy symptoms, then I would wait to get the vaccine until you're over it, because in some cases you have to take steroid medication or take a medication like acyclovir or valciclovir to help, with the symptoms. So you want to make sure that those medications have done what it's supposed to do. You've completed the medication before you go get the vaccine. Chat with your doctor about it just to make sure, though, because you may still be safe to go ahead and get it, but if you're on high dose steroids, we recommend that you wait until you complete it before you go and get COVID-19 vaccine. And I want to say that I'm just pulling up my data here regarding Bell's palsy. It actually occurred with both Pfizer and Moderna vaccines, and it looks like mostly it occurred after dose 1 that it was noted. On day 1 and after dose 1 on day 37 with Pfizer. And after dose 2, incidences of Bell's palsy was noted on day 3 and 9. And with Moderna around day 22 and 28. So it's just important to know that it is a possibility, but it doesn't mean you can't take it. All right, can I still get the COVID-19 vaccine if I've already had COVID-19? Yes, I did discuss that during the presentation. You most definitely can. In fact, we still want you to get your vaccine. Wait, if you have coronavirus, make sure you're over it. You're not acutely ill, meaning you don't have a fever, coughing, body aches, just make sure you're over it. And if you can wait 90 days before you get the vaccine, that is what's recommended. Do I have to get the same COVID-19 vaccine for the second dose? Yes, that's a great question. Yes, you do. It is not recommended that you get, for instance, Pfizer on dose 1 and then go get Moderna, just because that's what you're able to sign up for. We want you to keep it the same. The clinical studies that were done were conducted on patients who received both vaccines of the same kind. So there hasn't been any studies right now that tell us how effective they are by mixing the vaccine. So it's not recommended that you do it. If it happens inadvertently, you show up and you forgot your card, they don't have records that shows which one you had, then and you get it, then it's okay. It doesn't mean you have to start all over again. In fact, the CDC recommends that you just go ahead and get it and leave it alone. Don't go and get another one or a third one. But if you can get both of them, that is what you should do. All right, when will I be able to get the COVID-19 vaccine? Yeah, so you'll have to sign up on the Virginia Department of Health website, Vaccinate Virginia, which is the new one implemented today. Traffic on the website was really busy this morning because it just opened this morning, but keep trying. If you can't get in, keep refreshing your page, get in and pre-register, and you'll be contacted with an appointment to get your vaccine. All right, can I get the COVID-19 vaccine if I have allergies to certain foods, pets, and other medications? Yes, you can. You certainly can. The main concern is if you have an allergy to a particular ingredient in the vaccine, which is known as PEG, polyethylene glycol, I believe. So if you have a allergy to that, and you know for sure that that's what your allergy is, then you cannot get COVID-19 vaccine. And if it is an allergy that's so bad that caused you to have something called anaphylaxis or severe allergy, where your face had, swollen up really bad, your eyes got really swollen, your lips got swollen, and you felt as if your throat was going to close, that is a strong indicator you cannot get the vaccine. I do want to mention that if you have severe allergies, or if you are just nervous and you're scared, you want to make sure you don't have that allergic reaction. How do I know? You don't know, or you've never gotten your vaccines before. Make sure when you go to the vaccination clinic, wherever you go, you have the right to say, I want to make sure in the event of an emergency of anaphylaxis, even though my risk may be low, I want to make sure you have an EpiPen available. Each clinic, each site that's giving the vaccine is supposed to have 3 EpiPens available. You can ask them, do you have these EpiPens available, and do you know how to use it? Because that's important. You don't want to just have it and you don't know how to use it. So make sure that they have it, and you can go ahead and request that they have it nearby. You want to be able to see it to set your mind at ease. All right, I had a lingering headache, body aches, and fatigue with the first vaccine. I am nervous to get the second one. Should I wait? Will side effects be worse with the second vaccine? And when should I feel safe to return to working in a public setting after getting my vaccine? Great question. And that addresses many concerns I know for people who are anticipating getting the vaccine, or you've had the first dose and you had terrible side effects. Just know that those side effects, while they were miserable, they were needed to really assure you that you've mounted the appropriate antibody response. And it's not a guarantee that you'll have those same symptoms with the second vaccine. Normally, I don't like to use myself as an example, but I will tell you, the first vaccine, I had Moderna. My husband had Pfizer. With both of his vaccine doses, no symptoms, no side effects whatsoever. Nothing. Maybe just a little bit of a sore arm. But for me, I had Moderna. After dose 1, I was down and out for about 6-7 days. I just felt terrible. I had swollen lymph nodes. I had body aches. I was just miserable, terrible headache. But it did not deter me from getting the second vaccine. And I'm glad that I did. The second vaccine, I had no side effects whatsoever. So it doesn't mean that if you've experienced it on dose 1, you'll experience it on dose 2. But if you do, again, you want to exercise the same remedies, resting, take Tylenol or ibuprofen as needed, stay well hydrated, and monitor your symptoms. This too shall pass, as we say. Those symptoms will go away, and you'll be effectively vaccinated in the end. All right, I'm going to turn my attention to the chat box here. Does thyroid condition affect my ability to have the vaccine? Good question. No, it should not. So your thyroid condition, it doesn't matter whether or not you're hypo or hyperthyroidism. Hopefully your thyroid levels are controlled, meaning you're taking your medication the way that you need to, so that your numbers are good and that you're not experiencing any complications from thyroid disease. As long as you're healthy, you're maintaining your thyroid condition, taking your medication the way that you're supposed to, you can still get COVID-19 vaccine. Most of our health conditions will not cause you to, put off getting the COVID-19 vaccine. It truly, really is if you are acutely sick with coronavirus, high fever, not feeling well, or severe allergy, or weakened immune system for those patients who absolutely probably should wait or just chat with the doctor to see if they are a candidate to get COVID-19 vaccine. Okay, I don't see any more in the chat box. Make sure I'm not missing anything. All right, well, it looks like that's all I have for the questions in the chat box and the ones that were submitted. If you do have any others, feel free to ask general questions, but any specific questions, please be sure to direct it to your provider. My hope is that this webinar was helpful to you in making your decision to get your COVID-19 vaccine, and I'm hoping that's a resounding yes, that you'll get it to protect your health and those of your loved ones. Thank you. Thank you for attending, everyone.
Thank you.
Great job. Wonderful. Thank you so much.
Thank you.
Everyone.
You're so welcome.
I appreciate that. Wonderful. Can we close out in prayer? Is that okay? All right.
Absolutely.
Wonderful. Lord, thank you so much for Sister Jones giving this wonderful presentation, information to everyone that decided to join us this evening for this COVID vaccination webinar. I thank you so much for the information, and I pray, Lord, that we all take it to heart and really help us, Lord, just to continue to move forward, not out of fear, but out of faith. I thank you so much, Lord, for blessing us with this time just to have this information, Lord. We can just, not only for ourselves, we can share it with family members and friends and loved ones as well. Lord, be in our midst each and every day of our lives to make these critical decisions for our life and for our well-being. We thank and we bless you for our time on tonight. In Jesus' name we pray. Amen.